Let us look at the intervertebral foramen and the structures passing through it. The intervertebral foramen is located behind the intervertebral disc and the vertebral body. So here is the anterior aspect. So this is the anterior aspect and the spine is the posterior aspect. Now you can see the intervertebral foramen behind the body and the disc. And above you have the pedicles, the superior pedicle and the inferior pedicle, which forms a notch, superior notch and the inferior notch. And behind you have the vertebral bodies and the facets articulating. So this is the boundary of the intervertebral foramen. What constitutes the intervertebral foramen? The foramens in the body contains mainly the neurovascular structures. That means it will have a nerve and vein and artery. So let's first see the nerve. The nerve which is arising from the spinal cord is called a spinal nerve, which contains two roots, a ventral root and a dorsal root. Ventral root, of course, is seen anteriorly and dorsal root posteriorly. So both joins to form the spinal nerve, and you can also make out the spinal or the dorsal root ganglia here. So ventral root, a ventral root, a dorsal root and a dorsal root ganglia. These are the constituents, the neural constituents of the intervertebral canal. Similarly, look at the veins. There are two plexus of veins. An internal plexus, which is inside the canal, and external plexus, which is outside the vertebra. Okay, you can make out very clear. So there is an internal plexus and an external plexus. So this internal plexus and external plexus are communicating through the intervertebral vein. So this intervertebral vein is also a constituent of the intervertebral foramen. Now the artery which supplies the nerves are called as a radicular artery, which is actually a branch arising from the aorta called as a segmental artery, which forms a radicular artery which supplies the rami and the nerve. And finally, there are transforaminal ligaments. The transforaminal ligaments are superior and inferior. So superior, inferior. Superior transforaminal ligament, inferior transforaminal ligament, and also there are ligaments called the corporopedicular ligament, that is from the body to the pedicle, superior and inferior. Finally, you have the recurrent meningeal nerves, that is recurring from the anterior ventral rami and supplying the disc, meninges and the body of the vertebra. Thank you.